My name is Cassidy. I live in San Diego, California. I had my daughter, Ivy, in November of 2024. I'm self-employed. I'm a small business owner. I have a tailoring shop in Carlsbad, California, where I specialize in Levi's and tailor any denim.
How
And
interesting. I've never heard of
yeah,
anyone in your
it's
generation
pretty
doing
cool.
Well, I got
that.
a few pairs of jeans coming your way.
Send them over. I am obsessed with vintage jeans or any jeans. I just love
Oh,
repairing and tailoring all. My husband, he works for himself. We love basically vintage things. He restores vintage cars. We live on a big property, so we're outside a lot. We have two dogs, two small dogs. And yeah, we go to the beach as much as we can. And that's about it. Yeah.
okay. So you're here to tell us your birth story. So do you want to start with
Yes.
conception, pregnancy? What makes sense for you?
So I think the main thing I want to highlight and talk about, which is something that before I conceived, or even before, 5 years ago, I never even knew what a fibroid was. I feel like nobody really talks about fibroids as much as maybe they need to, because I think more people suffer, women suffer from them than they even realize. So I think starting in 2023, I was having insanely painful periods, like debilitating. I had basically, I called it my happy week, where I had 1 week where I was not bleeding. I was not in pain. So when my period would hit, I was completely debilitated. I would end up spending, the only form of relief I could get was 8 hours a day in the hot bath. So I was basically spending all my time in my bathtub because it was the only relief I could get. The pain would get so severe that I would almost vomit, almost pass out. My periods were so heavy. It was disrupting my life for so long. I think until now I'm out of it. I don't I don't think I realized how much I suffered for years. I had to plan every event in my life around my period, which was basically 2 to 3 weeks out of the month. And I had like a week of just agonizing torture, is what it felt like. So fast forward, when my husband and I decided that we wanted to have a baby, I contacted my OB. We did the vaginal ultrasound, and we discovered I had two very large fibroids.
Sorry to interrupt, but I just
Oh,
am
no
very
problem.
curious. How long did it take before you actually got this diagnosis of fibroids? How many years were you suffering with that kind of pain
Geez.
before it was figured out?
Probably at least a year and a half to 2 years,
Okay.
because a lot of doctors, OBs that I saw, they were leaning more towards, do I have endometriosis? I tried everything. I spoke to so many different naturopaths. I did acupuncture. I took medicine. Everything I could think of. And then it dawned on me, well, I finally saw a provider that was like, let's do a pelvic ultrasound. And I don't really know why it took so long to get to that point, which
That's
is
my question.
interesting.
Like, why
Yeah,
did you not have an ultrasound the very first time you went in? Like, it's
I
crazy that
don't
that
know.
wasn't offered.
I know. In
It's not
hindsight, it's
hard to
kind of
diagnose
puzzling.
fibroids.
No, it's not. Um, I really don't know. I look back and it's so confusing that I kind of suffered for so long. And then so what was it? In 2023 is when I was finally diagnosed, earlier that year, with two large fibroids. I had changed providers. So the first provider was a male OB. He's like, yes, I want to do an abdominal surgery. There was no other option. He didn't want to do a myomectomy or anything like that. And so I was just like, no, I don't want to do that. I want other options. Fast forward, I ended up getting Kaiser. It's interesting because I had a really good experience with the doctors in the hospital there, which I was very shocked because I've heard completely different things about it. And as we all know, it depends on the nurse or nurses that you get and the OB and everyone that treats you.
And it depends
But
on what you're there for, whether it's a pathological
mhm,
problem or something like birth, right? Because if
yep,
these places can be excellent at dealing
yes.
with pathology, but not so
Oh
great
yeah.
at dealing with physiology.
Which is interesting because it kind of went in two different ways. And I'll get into that with the birth story, which was completely something that I never would experience, thought I would experience in a hospital. So I went to my OB and my new OB, and I actually really liked her. This is before all of this, the reason why I knew I didn't want to do the abdominal is because I started listening to your podcast. And I became obsessed with birth. And I think the reason why I became so obsessed is we moved into our house in 2024, and it's an old 1934 farmhouse. We completely gutted it. And up in the rafters, so we bought it from the original owner, and she said that all 5 babies were born in the house in the 30s.
Oh,
And
wow. Good vibes.
yeah, and that's what I thought. So we were renovating, we pulled down this big mattress that was like in the rafters, this old 1930s ticking mattress, and it was covered in blood. And our conclusion was back then you didn't have a lot. You know, they were very poor in the 30s living out here. We're like, that's the birthing mattress. And I'm pretty sure that's exactly what it was.
That's amazing.
And so I don't know, it just kind of like provoked this curiosity about birth. And I just started diving into every podcast I could listen to. I started reading all the Ina May books, and then I found your podcast, and I've listened to every episode. So I became very well informed. Back to the story. I found an OB that I loved. She recommended a myomectomy, a robotic myomectomy, which was little incisions instead of a big abdominal. So I didn't necessarily want to just do that because on the other side of it, she said, you're probably, the recommendation is to have a C-section 2 to 3 weeks before your due date. And I just didn't want to do that.
Can I just catch up here a little bit? I thought the myomectomy was to remove the fibroids.
Yes.
So was she suggesting that? And if you opted out of that, she would say, well, then we recommend a C-section if you keep the fibroids in the pregnancy. I don't see where one condition ends and one begins.
There's basically, she laid out 2 options. She said, you can try to conceive for 6 months, see if you can conceive. And if you can, that's great. And I had told her I want a home birth. Like, this is why my reservation of all of this. She said, try for 6 months. Let's revisit this in 6 months. And at that point, let's go forward with the myomectomy. And then after, say I get pregnant after the surgery, she recommended a C-section.
He's suggesting that she have a C-section, which is very common for women who have had any type of fibroid surgery, whether it's a major abdominal cut and removal or a myomectomy.
I thought the whole purpose of a myomectomy is to restore your uterus to like a whole condition and then let the pregnancy proceed and the birth proceed as normal.
But you have still disrupted the uterus, and anytime there's any type of cut into the uterus, it's basically the standard recommendation is C-section.
So I decided that I did not want to go forward with the surgery first. I wanted to try to conceive naturally. So after 4 months, I was pregnant with my daughter. I didn't even think I was pregnant. I was convinced that I was not going to get pregnant because I was bleeding. And come to find out, that's implantation bleeding. But I was so in my head because all I have done is basically bleed for months and months and months. I thought that's exactly what it was. So I had a great pregnancy, really. Early on, I only had a few weeks of being tired. I felt really good. I loved being pregnant. I also decided right when I found out I was pregnant, I'm going to hire a midwife. I do not want to have a hospital birth. I want to see what my options are. If I can find a midwife that's comfortable with me having fibroids. The reason why I thought it was a good idea is because of the location of my fibroids. They were in the location that seemed like it could be very safe. I ended up going with my midwife, Michelle, which I think about her all the time still. She had such an impact on my life. She was wonderful. She said that she had a lot of experience. She's been practicing for almost 40 years, a lot of experience with women having fibroids, and they had successful home births. And so she felt very confident. So I continued to see her as well as I continued to see my OB because I had part of that covered. And it was radically different experiences. I would go to my midwife appointment and I would be there for an hour, hour and a half sometimes. And I would leave on cloud nine, just feeling so excited, so happy. I would leave my OB appointment fearful, scared, upset. I mean, I'd be in there for 10 minutes, 15 minutes. And it was an interesting thing to see both perspectives. But months went by, everything was looking great. My midwife thought it would be a good idea because she just wanted to make sure, because when she was going in and feeling my stomach every time I was there, she's like, I feel like this is the baby's head, but I feel like this is also your fibroid right here. So she could feel it. I don't think I said about the size. Initially, when I first had the scan, my fibroids were 5 and 6 centimeters. So they were a pretty decent size. So she's like, you know what, I think that it would be a really good idea if you were referred to a perinatologist, because I think we need to have more scans done. And that's something I didn't want to do initially. I didn't want more ultrasounds. But considering I had these large fibroids, I just in my gut was like, you know what, you're right. I think we should do that. I think if the ultimate goal is to have a home birth, I obviously want a safe home birth. Everyone does. But I have potentially a risk. So it was a good idea. And it was her recommendation. My OB I was seeing didn't even recommend that. And so I started with a perinatologist. Around 7 months, I went in for a scan and an IUGR was discovered. I was devastated, and she was measuring very small. She hadn't really grown a lot since the last scan. And so, of course, they kind of switched gears. I'm considered high risk. And I just couldn't believe it. I was in shock that there's just no way, what's going on? And so I ended up doing the stress test. I passed it. I was continuously doing kick counts. I mean, it just more so made my fear just heighten and create so much anxiety going forward in my pregnancy. I was so scared every single time I was there.
Was it ever confirmed that you actually had a reasonable IUGR, intrauterine growth restriction diagnosis, or was your baby just measuring small for gestational age? Because
Well,
they need to do a series
it's
of them and see that the
mhm,
baby's growth is actually slowing.
right,
So
right.
if they see that a baby is just 10%, 9% on that bell curve, that's just a small baby. Did you ever get to the bottom of that?
Yes. So she was measuring under 5%. And then I went in for another scan to follow up around 8 months pregnant, and they had lifted it. She was growing. And so I'm like, oh, it's one of these flukes of ultrasound where it's measuring things off.
So you
Okay.
had the 20-week scan and then the
Yes.
7-month scan. And between
Yes.
those two intervals of time, it showed no or slow growth. And she was in the 5th percentile. That's how you got the diagnosis. And then when you went back at between 7 and 8 months, a month had gone by and she had grown normally.
Yes. They had
Okay.
lifted it. She was still small. And I thought to myself, I was a small baby. My mom had small babies. My
Exactly.
husband was 7 pounds. I was, I think, a little over 6 pounds. We don't really make big babies in my family. All of my cousins were small. So I was just like, I don't think I'm going to have a big baby no matter what. So that was always in my head.
That's right.
And so I'm like, I think she's going to be small.
Mhm.
And when I went back in for that scan, she's like, everything's looking good. Like, she's gone up since then. The growth is correct. She's little still. My fibroids, and it's funny because every time I went in, they were focused heavily on my baby, but I just kept asking the perinatologist, I'm like, what about my fibroids? Have they grown? What's going on with those? Why are we not more focused on that as well? Because it's a big risk. And they had grown. At this point, they were, I think the biggest circumference of one of them was 9.6 centimeters. So they had actually grown quite a bit. And I have a very small frame. And so I forgot to mention at 5 months pregnant, I looked almost 7 months pregnant because I was so big, because I was carrying basically like three little babies is what it felt like. So at 8 months, they lifted my IUGR. and I just continued planning my home birth. The midwife came out and we did the whole home visit, and I was just getting so excited. And then I went in. I really didn't want to go do another ultrasound. I was like, it's been lifted. I feel good. And my midwife was like, I think you should. I think you should just do that last ultrasound, just because my fibroids were big. And the one thing that I will say, my husband initially, it took some convincing to get him to be comfortable with having a home birth. And it's because of my fibroids. He does a lot of research on his own. And I think the one thing he kept hyperfixating on, for good reason, was hemorrhaging. My husband was just, he was really worried about me hemorrhaging. And my midwife was so good at just explaining everything, like what she can do, what the protocol would be. So I felt pretty confident that time. So did he eventually, but I think still in the back of his head, he was worried about that.
Can we just explain also to the listeners why fibroids increase the risk of hemorrhage, especially based on size? And was it explained to you that the risk of hemorrhage was basically because of the inability of the uterus to clamp down with the fibroids, right? Not necessarily the fibroids bleeding in the way that they had during your menstrual cycle.
Well, the interesting thing about fibroids that I never really realized is they are their own blood supply. They have their own blood supply and they're getting it from you. It's not like a cyst. It's kind of, if you think about it, they're pretty evil. They take what they want from your blood supply, they get bigger, they feed off of you. So the concern was, when it comes to my uterus contracting during birth or potentially after birth, they're worried about me bleeding, not being able to stop it, because there's basically something in the way at that point, or something shifting.
It's similar to what happens when there's a retained placenta
Yes.
and the uterus
Yeah.
can't contract around it. So it's
Exactly.
a very legitimate concern.
So I decided to go forward with that last ultrasound. I felt like it was very necessary. My midwife said it was something we should definitely look into. So this was Halloween of 2024. I went in for my ultrasound, and the perinatologist looked at me and said, your IUGR is back. She has not grown at all since your last scan. She is very small. She's measuring barely over 4 pounds. So not only that, she said, I can only find one pocket of 2.2 of amniotic fluid. She's like, I can't find any more. It's pretty empty in there. She's like, I really believe you need to be induced today. Like, I think you need to go to the hospital today. And I just, in my heart, I know it probably sounds crazy. I think some people would think that it was a really silly thing not to do, but I was like, I need another opinion. I want to go have another scan. So I called my midwife, and she calmed me down and said, you need to go see my guy out of network, out of Kaiser. So that next morning I was there at 9 a.m., had that second scan, and he also agreed my fluid had gone down to barely a pocket of 1. So I had no fluid, which that means she's not eating, she's not peeing. So there is something going on. I was like, okay, she does have a possible IUGR because she's not growing. So I agreed to an induction. And I was at this point 37 and 1, I think. So I went in. Well, I came home first, and I had my entire home birth kit set up already. And I came home and I told my husband, you need to get that out of the room. Like, I can't come home to seeing that birth kit sitting here. It's gonna destroy me. So he put it on the closet, put it away. I checked into the hospital at 4. And the one thing I had told myself, I can do an induction and I will do an unmedicated induction, because I just felt like if this is the one thing that I can still control in this entire situation that has gone completely out of my control, is I do not want to be medicated. I knew that in my gut, I felt like if I had received an epidural, I would end up in a C-section, just because I feel like I'm so sensitive to medication. And I kind of felt like she would be sensitive with me, and it just wouldn't work for us. And so I'm like, nope, I'm not going to have any meds. So I checked in 4 p.m. I got a nurse. His name was Jesse. And I just want to point it out just because my nurses ended up being quite amazing, and I was shocked. I went in very negative, I will admit. I'm pretty sure he could tell I did not want to be there, but he was so bright and light, and he's like, all right, what are we doing today? And they had a whiteboard on the wall, and it said, tell me what you don't want. And he wrote every single thing that I didn't want. I said, no vitamin K, I don't want this, delayed cord clamping, and he just wrote it all down. And he said, do you potentially want to have an epidural? And I said, no. He's like, okay, well, if you change your mind, just so you know, it could take up to an hour to get you that epidural. So if you get to a point, you have to keep in mind, it might take a while. I'm like, that's fine. I don't want it. And at that point going forward, he never asked me again about anything that I had already told him I didn't want. And so they started the Cervidil around 5 p.m. It wasn't horrible. I mean, I felt some cramps. And then at 1 p.m., my husband and I are sleeping finally, and I get woken up by like 6 nurses coming in, grabbing me, flipping me over, like completely manhandling me in like it seemed like a very violent way. They were just on top of me, pushing my stomach, pulling me over, really aggressively. And apparently, well, they had told me that I needed to be monitored, which I didn't want, but they insisted that I should be monitored. Her heart rate had dropped to 55 to 60 beats per minute, lasting almost up to 5 minutes. Oh, yeah. And I was sound asleep, and it was just such a shock to be woken up to. And they had flipped me, and they wanted to get me in a position quickly, and it worked. And she bounced right back. So I'm not quite sure what that was. It was very intense, very scary. It lasted literally like 2 minutes, and then they were out of the room, and I continued to sleep. It was quite shocking. So then come the next morning, they wanted to start the next form of induction. The Cervidil had worked, and they decided the best option. And prior to this, I had talked to my midwife. I'm like, what do I expect? What do you think I should do going into this induction? There's a couple things I knew that I didn't want. And she's like, I think another really helpful tool is a Foley bulb. And so they agreed to the Foley bulb. I will say that was probably one of the worst parts of that experience, is having that inserted unmedicated. So they inserted the Foley bulb, and then we just waited. I think so another 12 hours, almost 12 hours had passed. The nurse came in. She said, okay, we're going to check to see if you had dilated to 3 centimeters. If so, I can remove it. And so I was just talking, and she was checking, and then announced to me, luckily she didn't tell me, but she just popped it out. And that was like shocking in itself. But in hindsight, I'm glad she didn't tell me she was going to do that, because I'm pretty sure I would have tensed up. But that was intense as well. So now I am 3 centimeters dilated around 4 p.m. And then at this time, I had requested to have a midwife assist my delivery. And so she came in, and the one thing I will say that I was pressed heavily about was, so I had tested positive very early on for GBS, and she was very adamant about me doing antibiotics, and she pressed me a lot. And every time she came in, I told her no. And then it was just to the point, I think, that I was so sick of telling her no. And it's funny because the nurse that I love, Jesse, was there, and he was just in the back, like trying not to intervene because he knew I didn't want it, but he was like on my side. And it's funny too, because I had 2 nurses the entire 2 days I was there. One would leave. I had this other great nurse, Rochelle. She would arrive. She would leave. Jesse would come back. He would leave, and she came back. Like it was, they were like a godsend at that moment, because they were so understanding. And it's just, I know how that can go with nurses in a hospital, and someone I feel like was watching out for me, because they sent me 2 amazing people that really listened to what I wanted and did not press me at all. So going back, the midwife came in again, and she said, I really think it'd be a good idea to get 2 doses of this. You tested for this early on in pregnancy. And I said, look, I will agree to it, but I will not agree to it until I'm 6 centimeters dilated, because I don't want a continuous dosage, because they give it to you every 4 hours. Yeah. So sometimes if your labor lasts an extended period of time, you're getting quite a few doses of that.
That was a great decision.
I think so too. And I just knew. I'm like, first of all, I don't want this. So if I am going to do it, it's going to be like the smallest amount possible.
Yeah. So just so everyone
And
understands, with GBS, when they do recommend the antibiotics, you're good for about 4 hours. So if you have the baby
mhm,
within 4 hours, terrific. And if you don't, then they give you another dose to buy you another 4 hours. If you're not
mhm,
even 6 centimeters yet, the odds are reasonable that
mhm,
you will not. I mean, we don't know, but the odds are reasonable for the majority of women, probably, that if you're not yet 6 centimeters, you very well may still be in labor for
mhm.
more than 4 more hours. So you might as well
Yeah,
wait till you're in active labor. So you probably did save yourself a dose or two there. Well, I don't know. You
definitely.
tell us. You tell us. How much longer
Yeah.
are you in labor? You have the
She
answers.
she really wanted me to do it, and I was like, nope, just one dose right now. Starting at 6 centimeters. At that point, when they took the Foley bulb out at 4 p.m., I was 3 centimeters. And then they started the Pitocin. And Jesse once again was there, and I told him, I'm so sensitive to medication. Can you please start me low? And he looked at me and he said, I only start everybody at 1. All the other nurses start everyone at 2. He's like, I'm only going to start you at 1. And he truly was sweet. And I think about him a lot. And so he started me at 1, and it began progressing pretty quickly. So around 5 o'clock, I had that first dose of Pitocin, and then it just slowly started to rev up. I started to be able to really feel those contractions from the pit, and I was standing, moving around as close as I could to the bed because I was still connected to cords because they were monitoring me and my IV, and so I was just kind of on my bed, near my bed, bouncing on the ball, standing. My husband was doing counter pressure. It got really intense. By 8 p.m., my nurse was like, "Can I check you again? I think you're progressing." And so she checked me and she's like, "Oh, you're at an 8." And she called the midwife. The midwife ran in there so fast and gave me the antibiotics, even though it was like past the 6 centimeters, but I had progressed so quickly. And so I did that, continued to rock and move and bounce on the ground, on the ball. And all of a sudden I looked at my midwife, and it's like that classic phrase that everyone says. I'm like, I think I'm going to poop. I feel like I might poop. And she's looked at me, she said, "Oh, that's not poop, that's your baby." And so I got on the bed on all fours, and just it got those contractions from that Pitocin were so intense and so painful. But I was just like, I can do. I'm in it now. I'm doing it. I feel like I kind of went somewhere else because a lot of the stuff my husband told me, I'm like, I have no recollection of that. I was on another planet, and so I was on all fours, and I think that's when she started to really descend. And so the midwife came in. I mean, she came in so fast. She was trying to put her gloves on because everything was progressing so quickly. And then at 9:50, I started to push. She made me get down on my side, which I really, really wanted to be on all fours. It just felt the best. But she asked me to get on my side, which I think if I was a little more with it, I probably wouldn't have. But I was just kind of going with the flow because I kind of was just hoping at that point with the pain. So I was on my side, and it was happening really fast. And I think at this point, when I looked at my records, I pushed for basically 10 minutes, but I have no recollection of pushing. I'm pretty sure my body was just doing the work for me. And at that point, the midwife asked if she could break my water. She's like, your baby's right here. One more push and she'll be here. Can I break your water? Which was great because she asked. And at that point I said yes. And within the next contraction, she was out. So I think it was kind of the one thing that was preventing her from making that final descent. So I agreed. I pushed her out, and it was great. She came out. They put her immediately on my chest. One of the nurses had asked if she could take photos with my phone prior to this, and I said yes. And so I have all this documentation, which is great because I have timestamps of everything. And when I looked at the timestamps, they actually waited, and I told the midwife, please don't cut the cord. Please don't cut the cord. And she waited, and the timestamp showed that they waited 6 minutes. And so she was on my belly for 6 minutes. She came out as dry as could be, bright pink, no fluid, no meconium, no
Vernix.
vernix, no blood, like so clean, so pink, and put her on my chest. She cried very loud. She ended up weighing 4 pounds, 6 ounces.
Oh my gosh.
So she
What?
actually was tiny,
Wow.
tiny.
Was she how many weeks were you now? 37?
37. Yeah.
So she would have been called a preemie if it had been before 37 weeks, but she was born at or just after 37 weeks.
37 and 2.
So technically a full term baby, but very small.
Very tiny.
Wow.
And so she ended up, her APGAR was 9.
Wow.
So she
Strong.
was tiny, but mighty.
Yeah.
And so they cut the cord. They immediately tried to latch her, which was great. And it was an amazing experience. And then about 20 minutes had passed. The nurses were on my belly doing the lovely fundal massage, which is no such thing as a massage. Like, they need to rename that. That was also very painful. The doctor or the midwife, I had a couple like 1-degree tears. And so she left the room. She did her job. She left. The nurses were cleaning everything up. And I started to see the nurses kind of, the look on their faces kind of changed. And they started to look panicked. And they were frantically trying to collect all the Chuck's pads because they needed to weigh to see how much blood I was losing. So one of the nurses ran and she went and got the OB that was working. The OB comes in. She doesn't look at me. And I'm like, oh my God, who is this woman? And she just sticks her hands inside of me and just starts feeling and like figuring out what's going on. And I'm just sitting there. At this point, I feel like I'm in shock. My daughter has been moved off my chest. And I'm like, I can't believe, like, who is this woman? Why is she doing this? And the nurse leans over to her and says, she's not medicated.
I mean, it's just like the fact that you didn't have medication to me is not even the point, because if a woman had medication, what would they just be rougher? So anyway, what happened?
Yeah.
What was going on? Were they concerned about hemorrhage in that moment?
So I think that I had begun to hemorrhage so much when they told her how much I was hemorrhaging. I think that when she came in, I agree with you. Another part of me, I think that she had been notified that I was basically bleeding out. I think because they knew I had fibroids, or I don't know, maybe she read something about that before coming in. I'm not quite really sure.
She probably knew. She probably knew. And it is just, that is protocol. If somebody is hemorrhaging severely, it's called bimanual compression. They go inside and they actually compress the uterus between their 2 hands. And she probably was trying to feel if there was any retained placenta in there, anything that she could remove. However, she still could have, as she was going to start this process, said, you're in a crisis. I need to do this. Do I have your permission to go inside your uterus? It takes 2 seconds to ask permission.
I forgot to mention, and I want to mention it real fast before I move on, is I birthed my baby. And then a couple minutes later, I birthed my placenta. And they wrote in my notes it was a spontaneous placenta birth. But I'm like, shouldn't they all be? Like, you know, because they like to
they think it's their job.
When I birthed my placenta, I asked, can I see it? And I wanted to see it. And so the midwife actually brought it over to me, and it was half the size. It was half the size it should have been. And what we later found out was the fibroids were basically leaching off of my placenta.
Was your placenta attached very closely to the fibroids?
Yes.
That's why, right? So
Yeah,
she truly, you never actually outgrew the IUGR diagnosis. They just misdiagnosed it in the middle when they told you that you didn't have it anymore. You always had it.
Yeah. Exactly. So back to, I'm hemorrhaging. She comes in, she's in there feeling around. I'm kind of at this point almost about to pass out because the pain is so intense. She looks at me and she looks at my husband very seriously, and she says, I can feel your fibroid. Your fibroid is coming out of your vagina. And so with my contractions, it had pushed my fibroid so far down that she could feel it. And she looks at my husband and she looks at me and says, this is very serious. I'm going to need to try to save your life. We need to rush you back to emergency surgery right now. She said, first of all, I'm going to try to save your life. Then I'm going to try to save your uterus, and I will remove the fibroid, and I'm going to do what I can. and it was just very serious. And at that point, my husband was devastated and panicking, and I think I kind of just disassociated for a moment because I couldn't really fathom what was happening. I think also I was losing a lot of blood, so I was feeling really off. And at that point, I said, "You got to give me something for the pain, like right now, because I can't handle this, and I need to go somewhere else because this is scary." So they immediately started medication, and I just kind of, at that point, I didn't care. And my husband, I think, was so confused by my reaction, but they had started the pain meds, and I just was like, I kind of have to go away because I'm willing into surgery right now.
Well, yes, exactly. You were about to have surgery. You had to have pain medication anyway. And
Yeah.
hopefully they're also giving you a blood
Well,
transfusion.
they gave me fentanyl right when I said, "You got to give me something now." And as they gave me fentanyl, then they took me away. So I was kind of out of it when they took me into the operating room. So fast forward, I wake up the next morning. I was so out of it. It was like I was in another dimension. I had lost over almost 2 liters of blood. They didn't realize, the doctor had told me they didn't realize how much blood I had lost initially. And she's like, we really, and it's funny because she kind of divulged a lot of information that I don't think a lot of doctors would have. And it's interesting because initially when I saw that woman and she came in, I was just like, oh my God, who is this lady? In hindsight, because of her, and it just so happens, and I truly believe I had some angels looking over me, the other doctor that assisted the surgery, her name was Dr. McMullen, and she is the lead fibroid myomectomy specialist in all of Southern California. And she was working. And between those two surgeons, initially, if you have a cesarean and you have fibroids, they will not touch your fibroids. You have to go back in for another surgery.
I was actually wondering about that earlier. Okay.
Because it's risk of more bleeding, and they don't want to do that. And so before she wheeled me back, she said, "I'm going to try to get the one fibroid out, but I'm probably not going to touch the other one. It's too risky." And so because the other doctor was there, she was like, "Nope, I'm not leaving that behind." And so she made sure that they got everything out of there because that's her passion. That's what she does.
So they saved your life and they saved your uterus and got both
and my
out.
uterus.
Wow.
Yep. And it's interesting too, because afterwards, when I spoke to the doctor, she said that her and Dr. McMullen were heavily questioned because of what they did. They went completely against protocol. They had to go up in front of a board and explain why they did that, because they were not supposed to take two normally. They wanted them to pack my vagina, like pack it, like all these other things that they're like, no, if you would have been there, you would have done this. We had to do it. This was necessary for her.
Wow.
And they went against basically what they were supposed to do, and had to be questioned for it, which was
Amazing.
really interesting. So then I woke up. I was so weak from having no blood. It was terrible. I was on morphine. I felt like the first couple days I wasn't really fully processing, like I have this little baby here, and I was so scared that I wasn't going to have any milk because I had no blood. I had 2 blood transfusions. And by the grace of God, I had a lot of milk. My milk came in the next day, and I had plenty of milk. But the recovery was pretty brutal because I was recovering from both a cesarean, essentially, because they cut me open like a cesarean. I was recovering from a vaginal birth, and I was recovering from losing almost half my blood volume. So it was
And a
intense.
fibroid removal.
And a fibroid removal. Yeah.
Fibroid removal. I mean, that's really unbelievable, the whole scenario. And the fact that you were where you were when you gave birth is really saved your life.
It did.
Did you get clearance to have a vaginal birth if you have another baby?
So I was really worried about that initially, because the one doctor was there and the way that they performed my surgery. Usually with fibroids the size of mine, they do not do a hysteroscope type of surgery to remove my large ones. But they said because she was there. That's what she does. She's an expert at it. They removed them that way. And so she felt like I could definitely have a vaginal birth and I could choose that if I wanted it, which is really amazing.
That is amazing
to hear that. I went back in for an ultrasound about 6 months ago and she confirmed that everything healed very nicely.
Wow.
But yeah,
it's kind of like a series of little miracles.
It really was. If I talked to the doctor, I said, they wanted to induce me the day before and I told them no. And she's like, well, we weren't working those days. And the doctor told me, the first doctor, her name's Dr. Romero. She's all, I will say, not every surgeon is the same. You sometimes, they're not all at the same skill level. Everyone's a little different.
You may still, very likely would still have had your life saved, even if you had a home birth, by the way. I'm sure your midwife would have made an emergency rapid transport and called 911 and they, could have possibly done a blood transfusion to get you to the hospital, but you probably would have lost your uterus. It had those two doctors not been there that day.
I think it was, possible for sure.
Knowing now what happened with your birth, do you wish that you would have had those fibroids removed before you became pregnant? And secondly, I think it's important that we acknowledge how much your own intuition played into this scenario working out the way it did, because when it came time to have that induction, it felt like the right option for you, right? Like you felt good about the decision you made to decline it the first day and choose it the next day. That felt in your gut like the right thing to do, which is why it's so important that we listen to ourselves, because, it obviously was very important in this scenario that you give birth in the hospital.
Yeah, agreed. I think if I would have changed anything, no. I know it would have been potentially an easier birth. I mean, who knows what else, but I have my daughter. I don't know that I would have her. It all happened for a reason, and I'm very happy that it did.